The first rookie paramedic mistake is their communication skills. As a paramedic, you're in charge of patient care. You also have the family, the bystanders, the patients, the FD, your fellow crew members with you, looking at you. What are we doing next, right? What's the next best step? And everyone's looking at you. You have to have concise communication on emergency scenes and non-emergency scenes to be a sound paramedic. You're gonna learn this from your senior paramedics, watching what they do, how they're able to talk to people, get down to the patient's level on calls that are non-emergent, be really good at delegating tasks and being concise with the information and good communication when they're on emergent calls. The number 2 rookie paramedic mistake is an IV access. So many new medics do what I call the dive bomber. They go right through the vein. So what we want to do is we want to make sure, here's our vein in the patient's arm. We want to get to a little bit of an angle, right? Not a stark angle, just a small angle. We want to first get flash. Once we get flash, at the same time as we're advancing the catheter, we want to level out like this. And now we're actually in the patient's vein. We can go through it. So when you advance your catheter, level out your angle. And now you're in the vein, right? The next thing with IVs is selecting the right gauge and remembering how long that catheter is. We have to make sure that catheter fits in the entire vein. It is okay and fine if you can only get a 22 gauge or a 20 gauge IV. You don't need to get a 16 or 18 gauge IV. If you're able to get 220 gauge IVs in a patient who appears to have tough veins to hit, that's fantastic. You're in a bumping ambulance going down the highway, lights and sirens. That's phenomenal, right? So don't be a superhero. Get the access you can to give the meds you need to give and the access you need for this patient. The third rookie paramedic mistake is delegation to their team. I know, because when I first started, I had trouble with delegation. You try to do everything yourself because you've learned so much, but here's how you tackle this, and this is what your preceptor wants to see and during your clinicals. Here it is. Any skill that you need to do because you're paramedic certified, no one else can do it, but the patient needs it, that's where your attention goes. Everything else, if they're certified to do it, delegate it. Delegate it. You get more done. Inside this small little section, I want to talk about one thing. Do not sit on scene when you have a critical medical or traumatic patient. You're a paramedic, you do things en route to the hospital. Never sit on scene. This one is a huge one. Number 4 is on tunnel vision. Tunnel vision means that you get called to a chest pain call and all you're thinking about is this could be a heart attack. You totally ignore all the other solutions that could actually be going on. So I'm gonna give you a quick mnemonic that one of my mentors taught me, and it's called, who's your PAPPA? If somebody has chest pain, you say, who's your PAPPA? Shout out to John Belinsky for this mnemonic. Now here it is. P is pericarditis. A is acute coronary syndrome. First P for pneumothorax. Second P for pulmonary embolism. Final one could be an aneurysm. These are the 5 worst causes of chest pain that can be in your patient. You gotta evaluate for all of those as a paramedic in the ambulance. And if you see it, start to treat it. Don't get tunnel vision and think that every chest pain is a heart attack. It might be one of the other culprits. So check out for that. Number 5 is writing narratives. You need to have a more enhanced narrative. You are the final say of EMS as a paramedic, meaning your documentation needs to include everything. So I want to give you 2 quick tips while I'm here. 1, if the patient has said something very important to you about their condition, put it in quotations in your narrative. For example, patient states, the pain started 30 minutes ago. Put that in your narrative. Another one is, I like to have a section in my narrative where it is just for pertinent negatives. What is a pertinent negative? A pertinent negative means, let's say You go to a patient with chest pain, but the patient denies nausea, vomiting, and denies back pain, and denies being a diabetic. On the flip side, what we're trying to say here is being a diabetic, having nausea, vomiting, and back pain with your chest pain, that is a really, really bad sign that you could be having a heart attack. If the patient says they have chest pain by themselves, that's it, just chest pain. No difficulty breathing, pertinent negative. No nausea, vomiting, no back pain, no medical history. That's a pertinent negative. Number 6, this goes out to any paramedic student, any paramedic preceptors, anyone who's a new rookie paramedic. You need to become a master of pharmacology and cardiology. You need to know all of your medication protocols, and you need to understand how to work this life pack right here cold. Meaning, you need to be able to read your EKGs cold. This is so important. Pharmacology and cardiology makes you the certified paramedic that you are. Take extra education steps to really master the pharmacology and cardiology and all EMS meds, prescription meds. You need to be a leader in this. It's what makes you, you. Now, if you're someone getting ready for school, maybe you're in school right now, or you're getting ready for your national registry exams at any level, from responder, EMT, advanced EMT, paramedic level, first link in the description is my video vault that makes all that so much easier. And you get access to our community group, and we're in the tens of thousands strong inside that group. Go in there, you can ask me questions. I will see you in the next video. Take care.